Yeah, so for us, this is a very busy hospital with lots of local DGH activity and also lots of tertiary work going on. We've had extreme challenges, particularly in winter, around capacity, and we need to be doing everything we can to make sure that we can flow patients as quickly as we can through our hospital. And we need to do that 7 days a week. We can't switch off on Saturday and Sunday because otherwise the hospital clogs up and we cease to function. Perhaps another motivation for us, and you'll see, I think, that we've been very successful in imaging in particular, and imaging is vital to flow, and imaging in patients is vital to flow. But there you've got the added issue about making the best use of what are often very expensive pieces of equipment. So we want our MR scanners working 7 days a week. We want our CT scanners in the same way working 7 days a week. So it's largely driven by emergency pressures, but also just by a desire to make sure that we make the best use of the facilities we've got. But it actually gets us off to a flying start on Monday and Tuesday because the tests have already been done. So we think there are benefits. I think if I'm honest, it's difficult to quantify them because we're operating on a moving situation, so that any improvement you make in one area, obviously there are lots of other factors, including ageing population, greater hospital use going the other way. But we think it's helped us, survive the winters essentially. I think the most important benefit to our staff, I think, is that they think they're providing a good service and that they're doing a good job. No one likes to come in on a Monday morning and see a backlog of work that could have been done but they haven't been able to do. So I think that's most important. I mean, clearly in some circumstances by working weekends people can have time off during the week. That benefits some people, but it's not for everybody. But that's something that can work, and some individuals in imaging have found that a positive. But I actually think that for me, the way that we've got it done is by appealing to people's desire to do the best job for the patients they're looking after. In any area, I mean, you have constraints, and probably the area that we struggle most in actually is endoscopy, and that's about lack of staff. Clearly one of the requirements for 7-day working is to have the staff to do that, or to be able to recruit the staff to do that. And we haven't quite reached that point in GI, so endoscopy is difficult to us, so staffing is important. We also struggled in general surgery theatres. I hope we'll see an improvement next time we measure it there. Again, that's about theatre availability to some extent, but also about utilisation. In the past, I think we've already struggled perhaps and overcome some of the difficulties in terms of consultant ward rounds. And I think the challenge there is actually, if you like, getting clinicians to absolutely be on board with this, to realise the importance of maintaining these high standards at weekends to keep flow going. And that really is about people understanding it's not just the patient they're looking after, it's the next patient coming in the door. And that's a challenge that I think people have recognised over the years. So we can point to sort of successes in this hospital. People talk about weekend mortality being high in other organisations, and it's not high in this organisation compared with weekdays. So I think those are benefits people see. But it is about winning hearts and minds and getting people to believe that there's a worthwhile gain, and that it's necessary, for good clinical reasons. I think 7-day services on its own will perhaps not motivate clinicians and other staff to want to deliver it. I think providing good patient care, the best patient care, will motivate people. I think that's what drives our clinicians. I think that's what drives our staff. So I think we should be doing it for that reason and with that in mind. Our 7-day working is very much focused on emergency flow, and I think that's the right way for it to be. Oh, it's what I do, to be honest. It's a job. It doesn't make me feel anything. You know, it's not nice if things aren't going well. If the worst situation is if you've got a hospital that well, we haven't got any beds. It's happened. You know, literally, we've got patients coming in, we've got nowhere to put them. That's horrendous. But as long as things are going reasonably well, you know, it's just a nice thing to be part of. I don't have any issues about working Saturday and Sunday. And to be honest, that there are lots of colleagues in emergency specialties who do a lot more weekend work than I do. I think it's part of the territory. I've never not worked weekends really.